here and drop it for me, like that, and returns this one, such that this place remains very clean and very sterile. So. Now, nowadays we have a lot of HIV, and we are trying to prevent children from contacting HIV. This one is in government effort to meet the Millennium Development Goals and to meet the Vision 2030. Some of the pillars of the Vision 2030 are entrenched in the health sector, because we need the health should be affordable, the health should be efficient, the health should be equitable. Equitable means everybody should get it. Affordable means easy for people to get. Then feasible, and it's everywhere. Now, these modern health facilities, they are everywhere within the 210 constituencies in the country. So we have this kind of what? So I was talking about HIV. If a mother choose not to go through cesarean section, do you know cesarean section? Yes, cesarean section is the removal of the fetus from the abdomen, yeah, using the in theater. You right? Now, a mother can choose to go through normal delivery. If a mother was HIV positive and she chooses to go through normal delivery, then we have to protect the baby from contacting HIV. By that, we give nevirapine. Nevirapine is an ARV, but we also use it to prevent the baby from contacting HIV. There is a way in which it acts to prevent the baby from contacting that HIV.
ORS, that means oral nutritional salts. This one enhances the salts and minerals you have lost from the body when there is diarrhea.
Because many diseases are coming up because people are not physically active, they are not eating the right diet. So the issue of physical activity, the issue of what we are calling healthy eating, it is not a matter of, we are telling people not to eat the junk food, the chips, the carbonated drinks like sodas and those will bring ill health in the community. But if you eat the natural food, the food that is not highly refined, you eat a lot of vegetables, you eat a lot of fruits, then you will be healthy. We are talking about early diagnosis. When people go for blood pressure, then you will be taken for the blood pressure, you will be told whether it is normal or whether it is high. Then also the sugar. Go for sugar tests, where you have the glucose meter or the glucose meter. You measure the sugar, and you are told whether your sugar is low, whether your sugar is normal, or whether your sugar is high. And when it is high, you are told you are diabetes. And signs of diabetes, there is what we call excessive thirst. We have what we call frequent urination. Keep on going to the right toilet to urinate. Then the thirst, you take the soda, you take the water, you take all juices, the thirst is gone. So that's what we are calling excessive thirst. Shoots up. So that's why people are told not to take the sugar, because it increases the sugar so quickly. The smoke affects the body of an individual. It will affect the hair, it will affect the eyes, it will affect the wrinkles, your body is not smooth, and all this. It can also bring what we call impotency. Then you can also be amputated. Then all of these things will be brought by smoking. And that's why we are telling, don't smoke, don't be exposed to smoke. The Tobacco Control Act forbids any parent or any teacher or any adult from sending you to buy cigarette for them. If they send to buy cigarette, you are under 18, they can be taken to court because they are violating the Tobacco Control Act. Under 5 years.
We bring this demonstration to the show so that we are able to tell the public the importance of our modern health facility. The importance of our modern model facility is giving the newly created things in our health facilities, and more specifically to reduce maternal child risk and to promote their health. Now, what we are saying here is that in health facilities we have skilled attendants other than the traditional birth attendants or giving birth somewhere else which is not the hospital. There are very many risks, especially the HIV/AIDS. If you deliver in the hospital, we are able to give you, we have drugs here like nevirapine, which is going to protect the baby from contracting HIV. And then we have all the instruments. They are clean, the procedure is sterile. We have modern equipments like the bed, draping, as you can see down here. We have the chemicals that are also used to prevent all this infection. So we are bringing this here to show the public the importance of giving birth to our health facilities. Just to add a bit is that the modern health facilities are everywhere in countrywide, and each and every constituency there is always one modern health facility.
Okay, so this is a division of community health services. As you can see here, this is we have the community health workers kit. This is what the community health workers use on the ground when they go to visit the households. This is just to enable them present basic and preventive health services to the community. We have a basic first aid kit here. We have male and female condoms. We have deworming medicine. We have aqua tabs for treating water. We have a thermometer, oral contraceptives, paracetamol, tetracycline for the oil infection, Salter scale for weighing babies to see whether they are underweight. Then in addition to the community health workers kit, we also have the community health CHIS household register. These are basic data collection tools used by community health workers. They're supposed to note down any health indicators in the household, like a number of children who are malnourished, number of infants, how many adolescents in the house, and such cases. In addition to this, we also have the motorcycle and the bicycle. The motorcycle is used by the community health extension workers. Bicycles are used by the community health workers. It's just to facilitate their movement and to enable them carry out their services more efficiently. Community health strategy, it's just to empower the community to be able to take charge of their health, and also to empower them when it comes to decision making in health and development related matters, and also to empower them be able to manage, implement health services at the community level, and also to create awareness on basic hygiene, and also to help them improve on their health so that they can be able to lead a quality, healthy life. And also to take services closer to the communities, because we find that a lot of community households don't actually have access to health facilities. So it's like we are taking health services to the people, to their households. Success level. Okay, it's picking up. So far we've been able to establish a number of community health units, and the response from the community is very encouraging. Of course, it's an ambitious project, but I think we're on the right track so far.
The Ministry of Public Health and Sanitation, through the Department of Health Promotion, produce a lot of materials in terms of brochures, in terms of flyers, in terms of posters, and other health promotion materials. They are meant to capture relevant health information, and we wish to assess and reach all our population with the information package we have, so that we have people who are well informed and who can therefore participate in all aspects of their continued enjoyment of good health. what we encourage people in this show is to pass through this stand, and that we have a takeaway literature for each of our visitors in this stand. Each of the visitor who is here is counted to have a takeaway literature, which is crafted in the best language to address Kenyans, so that when we bring to them issues of malaria control, they can best understand. We have posters that contains all aspects of health promotion, and through them we endeavor to persuade the public to adopt healthful lifestyles. And as a ministry and as a government, we have seen a lot of reduction of disease morbidity because of having a well-informed population which participate in all aspects of their health. So basically, we are concerned about boosting the health literacy of Kenyans, and we endeavor to do this with all the publications and other channels that we have access to our population. And we like people seeking all this information from the Department of Health Promotion, which is mandated to spearhead all related issues by the ministry.
This is the Department of Environmental Health, and here we have divisions like water and sanitation, food quality control, pollution control, occupational health and safety, and port health services. So basically here we are looking about vector and verum control, how we can control pests and some related diseases that they transmit to us. So here we have some pesticides or insecticides. This one is used to spray around the house, so that it controls cockroaches, ants, fleas, and it's also easily available in our local chemists at a friendly pocket price. So you use this on an earthen floor. You spray a little bit of it after sweeping the house, so that it can control the pest and actually kills them. This one is hydrogen peroxide. It is used for washing out jiggers. You mix the similar amount of water, then you use to wash out the jiggers, and they'll definitely fall down. Here we are trying to see how we can prevent cholera. Cholera is a germ-caused disease that causes watery diarrhea. So how do you prevent cholera? You wash your hands after visiting the toilet, wash fruits and vegetables before eating them, cook food thoroughly and eat food while it's still hot. Then after changing the babies, for their mothers, after changing the babies, you wash your hands, and all this you make sure you use soap and running water.
And we are displaying on the village sanitation, where we are explaining and educating the public on the village sanitation. And we have a household which is ideal for all the rural communities, and we are also advocating for roof catchment, rainwater harvesting, and we are emphasizing on the need to harvest the rainwater because of the shortages of the water sources, and also emphasizing on the need to purify the water at the household level. Inside here we are trying to explain and showing them that once they harvest the rainwater, we need to boil it, make it clean and safe for drinking. And we also have a water container for drinking, where we put in the water to cool. It's a model plastic pot that we are providing and telling the communities they can keep the safe and also prevent and be safe from diarrheal diseases. We are also advocating for the use of pit latrines, then mobilate toilets, plastic made, and we are saying we can use the locally available materials that is accessible and easily available to the communities. And for this, after using the toilets, we are calling for hand washing so that people are safe and secure from diarrheal diseases and any other infection. And we are trying to demonstrate to them the use of the DHP tap. The DHP tap is just a simple gadget that has to be used for hand washing, where we are telling the communities you do not need to go for the commercial tanks to provide the water sources which are tapped, but you can improvise and have the DHP tap, which you just need to tip the can like this, and then provide for water, and just wash your hands to be clean. This will save from any contamination because you just use your leg to tip the can, and then you wash your hands and you are safe and clean and you do not contaminate yourself. And on this other side, we have the improved pit latrine which has the separation. This is just a superstructure which needs to be mounted on a pit latrine. But we are using this area to harvest the urine to a septic tank, to a soak pit, or into a container, which is that urine can be diluted and can be used for the irrigation. So this is a modified pit latrine which have the provision of the urine and the fecal matter separation. So basically the issue of the village sanitation is an avenue and an exposure to the community and our population so that they can come and learn and borrow the information and the techniques and the technology to implement them back at home so that they can be able to use the easily and locally available materials which have low down cost and little or almost no skilled manpower that is required for use.
Names are Joseph Kamodo. I'm the public